Yes, many thanks for staying tuned with us on Frontline this morning. Now we move on to the interview segment of the show where we'll be discussing something else related. And you also recall that it's rainy season already and it comes with a lot of fun, excitement, and along with there are also a host of infections that are prevalent during this season. We have people should be aware of this problem so that they can take necessary precautions during this season. And the most common illness during this season is related to the respiratory system and water and foodborne disease, and this cannot be overlooked. So cold and flu are common, and that is fun during the rainy season, hence why we need to talk about it, why people need to take precautions and to prevent themselves or protect themselves from cold and flu. It's rainy season and there's a need for us to be aware of all of this. And joining us this morning to have this conversation is Mrs. Oluwatosin Olatokun, a medical practitioner, as we look at protecting yourself from cold and flu. Many thanks for joining us this morning, ma'am.
Thank you very much. Good morning.
Yes, so to start off, let's talk about how is it, what makes it important for us to, or let's establish the difference between cold and flu, because oftentimes people do mix the two together like they are the same thing, but I think they are two different things there. So what is the difference between cold and flu?
All right, thank you very much. Cold and flu are very similar in nature with just a very slight distance, and that is the main reason people mix it together. So to start with, let me just say the similarity, then the differences. So cold and flu are both respiratory illnesses which affect both the nostrils, the lungs, the throat, and that's why people come down with sore throat for both ailments. So cold and flu are common during this weather, I mean the raining season. And the major distinction between them is that when it comes to flu, when it comes to flu, it's caused by influenza virus, while cold is caused by rhinovirus. So the viruses differ, but they are both viral infection. So in terms of flu, which is the influenza, it comes promptly, while cold comes gradually. When you have flu, most times they are so intense, their symptoms are so intense that you might not really be able to work with it. Whereas cold, you might still be able to cope with it. It's a gradual thing and it's not that intense. The symptoms are not that intense compared to flu virus.
Yes. So one is more severe.
Yes, exactly.
Okay.
The flu virus is more severe than cold.
Oh, all right. So why are cold and flu so common during this rainy season? Fine, we know that it accompanies it.
Yes.
And you say that it's a respiratory
illness,
illness. So now, why is it common? Particularly if you look at what is happening presently, you see a lot of people are coming down with cold or flu.
Yes.
And how can we differentiate? Oh, well, okay, maybe this is a cold, and if care is not taken, perhaps it might lead to flu. Is that the case we are looking at?
Okay, firstly, the reason is more common during this period is because, during rainy season, most times it creates a kind of environment for this virus to thrive. The weather fluctuates, but most times very cold, watery, moist, and all these things. So it creates a kind of conducive environment for virus to thrive. Then another thing is, because of our bad drainage, we have lots of water that doesn't flow, and this causes malaria fever. And when you have malaria fever, it attacks the immune system. So when the immune system is down, easily all these viral infection can set in. And that is why in most cases, people with very low immune system get all this flu easily than people with high immune system. So at the same time, during this weather, the contacts and the way people prevent it, people tend to stay indoor. And when you tend to stay indoor, you increase the contacts between you and those that has it already. So this boosts the transmission.
Okay. So are there certain groups, like maybe children or some certain age, that are more vulnerable?
Yes,
okay.
yes. The number one, very low infants below 6 months or below 1 year old are more vulnerable to it. Then the older ones above 65 years old are more vulnerable to it. Pregnant women are more vulnerable to it. People nursing one kind of illness or the other, let's say kidney disease, lung issue, heart problem and the likes, they are more vulnerable to it. And people that has kwashiorkor with a poor nutrition can be more vulnerable to it as well.
Okay, so what are the symptoms that people should look out for? And it will also take me back to why we are differentiating between cold and flu.
Okay.
Because let's talk about the symptoms first.
Okay.
And how would they know, okay, this is cold, this is flu, and the treatment that goes for each of the two?
All right. Like I said, cold is milder and, you know, a little therapy. In fact, a little, what will I call it, home therapy. For instance, taking hot water, using vitamins, taking fruits, a lot of fluid intake, all these ones, these are natural therapy, can quickly suppress cold. But when it gets to flu virus, most times you need to take something like antiviral. Actually, when you see that you have used your normal therapy and it seems it's not working well, then you can think of going to see your health practitioners who will examine you and give you an antiviral medications to take. So that is when you know that this has actually migrated from cold to flu, because flu is more intense, it's more severe than it.
Okay.
You asked me one question.
Yes, the symptoms.
Okay, the symptoms, yes. So there is fever. In cold, the fever can be a very low fever of, let's say, 36.8, 37.0, 37.2, like that. But when it comes to flu, it's high fever. High fever that even you sitting beside the person, you can feel some heat radiating out of the person's skin. So this is flu. Then we could come down with sore throats. They come out with hair itching. So people will be itching their hair and making sound in their throats. These are part of the symptoms. They come out with body pain, body aches, and that is why most people mistaking this for malaria fever. They will say, they have malaria, and they will treat malaria. It will just suppress a little, and within 2-3 days, it comes out again because they are taking the wrong treatment. So it comes down with a lot of body pain, inability to do your daily work. So then there are other severe symptoms which you can liken to pneumonitis, lung infection, cough, severe cough, and there is this sound that they normally bring out, like a whistling sound when they are coughing. You will know that this is quite intense.
Now, I want us to cite a scenario because I need to clear the air about that.
Okay.
You know, sometimes when you have runny nose or catarrh, as the case may be, and it's linger for long, some people tell me to be maybe this person is suffering from infection, because after you've used all the medications that maybe you think that should cure the runny nose, and yet you have a catarrh that is going for 3-4 months,
yes.
A runny nose. So under what can we classify that, or is it something different entirely?
No, it's not something different, and this is it. Some people mismanage it, and that is why it's important to wash your hands very often. The way we get to the preventive measure, we'll talk more about that. You know, there's this inhaler they use. I really discourage this because it causes reinfection. Infection can reoccur again, over and over again, by using that. When you sneeze into your handkerchief or into your tissue, it's appropriate to discard and wash your hands immediately. So when there are improper management, the infection can reoccur. And there are some people that actually has issues, because I've known someone before that had running nose for over a year. So there are some people with such, I will remember the terms it's being called. So there's some people with such, and they normally put them on certain therapy which will reduce it, and with time it goes on its own.
A year?
Yes, it goes on its own. I've known someone very close to me after using so many medications, none of it worked. And with time, it went on its own. And more so, to also chip this in, this viral infection, most of the times, unlike bacterial infections, when you need to use antibiotics and the likes before it goes, if you are able to build your immunity well, eat good fruits, rest well, it can reduce and resolve on its own. It is only when you leave it for a while and it's not resolving, then you think you need to see a medical expert and take some medications that's touching it.
Yeah, you mentioned immune system the other time during this conversation.
Okay.
So I like to ask that, what can people do with this weather, with this season, to boost their immunity?
Okay, the first thing is, number one, self-hygiene. You have to be intentional about it. Your kitchen, like I discourage people leaving plates in their kitchen overnight. You know, insects,
that's common.
It's common, but it's not ideal because
really?
it brings infection, and infection reduces immune system. Then another thing is water. I was talking with someone about fruit intake. Fruits are expensive, but they are very important for us to take. But at least we can afford water. Water therapy is good. Very early in the morning, before you do anything, please try to take at least a cup of water into your system. It helps to flush your system, it helps to detoxify your system, and in other words, it boosts your immune system. Then intake of fruits is also important as well. You can find some little fruit like oranges, watermelon, these two alone. If apple is expensive, but it's good if you can get it, but you can, even if it's just orange, watermelon and the likes, you know, carrots, all these ones helps to build immunity. And another thing I would say about this is vaccination. You know, we usually we encourage people to get vaccinated against all these things. It helps also to build your immune system. Whenever you know that there is need to get vaccinated, please do not take it for granted. Try and be vaccinated against all this. It prevents it, and it helps to save money and you know, give you rest.
It seems some of these things are expensive and might not be at the reach of a common man.
Yes, yes, that's right. But at least I wanted to say water. I wanted to buy a bottle of water last week. They said 250. Oh.
Just imagine.
So if you want to take well water, it can also lead you to another infection. But in all, water therapy is good.
It's good.
Yes, and try to take a safe water.
That's important too.
Yes.
Now, if somebody maybe ignore all of these illnesses that we talk about cold and flu, are there some complications that may arise from neglecting or not taking appropriate treatment for these illnesses?
Yes, there are complications that can arise. Number one, the lungs might be infected. And when there is just one viral infection untreated in the body, it can spread. Infection spreads in the body. It can become systemic. From the lung, it can affect the kidney, it can affect the functioning of the heart, it can affect the brain, and even aside that, daily activities. Aside this, you also infect people. It also infects people in a way that when the infection load is too much in that person's body, easily you can transmit to other people. So it can be more complicated if it's left untreated.
Now let's move to the preventive measures. We wanted to talk about it the other time before I asked the question that what are the preventive measures people should put in place during this rainy season? Okay.
The preventive measure number one is hand hygiene. Hygiene generally, but especially hand hygiene. Ensure you wash your hands, because you sneeze, most people sneeze with their hands covering their nose, which is a very wrong one. If you want to sneeze, get a tissue paper, sneeze into it, discard, and wash your hands. If you are not close by to where you can easily wash your hand, and washing of hands, I mean with soap and water, not just wash with water.
Before you move on, you said sneeze into tissues.
Yes.
I've seen people sneezing.
Yes, it's not bad.
It's not bad.
Yes,
Oh, okay.
It's the right one. Either your sleeve or your tissue, then you discard. So you wash your hand at least for 20 seconds under running water and with soap. If there is no place you can do this, then you should have your hand sanitizer. Your hand sanitizer should at least be 60% alcoholic so that it will be more effective in disinfecting your hands and preventing you to transmit this infection to people. So another preventive measure is rest. When when you perceive this coming, giving yourself a good rest with good food, good hygiene, water therapy, it helps a lot. So, and the food we eat is very important as well. All this helps to build our immunity. Also, like I mentioned the other time, getting vaccinated against all this, it helps to build immunity. Ensuring your environment is clean, it helps to prevent infection and also enhance your immunity.
Vaccination.
Yes.
You mentioned vaccination for adults too?
Yes.
Okay.
There are booster doses that adults do take.
Oh, okay.
Yes.
Not that, because we have this mentality in Nigeria or in Africa generally that at a certain age, vaccination stop for.
No.
Okay.
No, it doesn't stop. It doesn't stop. It's just that it's limited. For infants, it can be in every 4 weeks till probably 18 months till age of 6 years. But for adults, it can be once in a year. There are other vaccinations adults take apart from flu or whatever. There are other vaccinations. When we talk about cervix, talks about other parts of the body, there are vaccinations we take as touching all those. So vaccination doesn't stop for any age, except, sorry please, it has age actually, probably above 65 years old. And they are exactly.
So those ones are exempted from vaccination?
They can be exempted.
Okay. Now, what advice will you give to parents, particularly with this cold weather and for school-going children too? Because though we know schools are wrapping up already, but we still have them at home. They will still go for summer classes and all. So what would be your word of advice to parents who have children who are still going to school or children in their care? Okay.
My number one advice is ensure you dress them up well. Most times they will tell you, I don't want cardigan, I don't want this clothes, I don't want that. You encourage them and tell them the reason. So ensure you dress them up well. Ensure they have at least probably a sanitizer in their pocket because they are prone to playing together, exchanging body fluid together. So, and another thing is, instead of buying them sweets today, like Acera or all these juice and stuff, we can do fruit therapy for them too. You can chop some fruit salad for them or probably just put it inside their bag to take. And all these things helps them a lot. And ensure, if it's possible, they might be bathing with hot water. It helps circulation, it prevents all this cold for most people. Yes.
So it's not every time you feel cold that you think it's malaria?
No. In fact, people mistaking this together a lot because the symptoms are so similar. So at times when you have cold or flu, people think, this is malaria symptoms. They will start to take anti-malaria. It will work for a day or two or peradventure 1 week and it will come again, or probably the symptoms will not even go because it's a wrong diagnosis. So it is not every time you feel these symptoms that you conclude you have malaria fever. It's good to go for a malaria test to be sure you have a malaria fever before taking any anti-malaria.
Remedies that they can also imbibe the practice to also manage the cold and the flu in this season.
Yes, but number one thing I would like to correct is, fine, we say fruits is expensive, but it's very safe for us to take. Can it be as expensive as medication? If we decide not to take fruit because it's expensive, then when it comes, are we ready to pay for the price of going for tests and buying several medications which you don't know the ones that will work or the ones you'll be resistant to or not? So let's just pray that God will continue to bless us so that we'll be able to do the needful. Then some home remedies we can do is, number one, we talked about hand hygiene. You wash your hand with soap and water. Then number two, our surfaces, because most times all these things thrive on the surface. That is why you see children when they are crawling or even all our grown-up ones can use the same hand they have used to touch surfaces, still use it to take something and put it inside their mouth. So it's very important that we disinfect all our surfaces at home. We mop our floors. We had probably Izal or any kind of disinfectant we had to it as well. Then we also try and prevent close contacts with people that has a cold or flu. We can do this by, exchanging pleasantries can be done just via exchange of greetings instead of handshaking or whatever thing. Then the use of face masks is also important in preventing this as well. So, and also it's good to go for medical checkup once in a while, probably once in a year, depending on your age. Then I've spoken about water therapy. Then rest is very important, please. Even the machines we use at home, at work, we allow them to rest, talk less of our body. So please, we should ensure at least 8 hours. That's the best for adults. But because of our daily activities, even if you are unable to achieve these 8 hours, at least there should be a time within a week or a month that we will have a time of rest. Let's rest well before our body demands for it, because by the time our body demands for it, we might not be able to meet up with it easily. So let's exercise, rest, and this will go a long way to help us.
Exercise too, I think that can also help.
Exercise helps as well, but when you sweat out, yes, exercise helps. It helps a lot as well.
You said that these people that use is it inhaler now?
Yes.
That is not good.
It's not good. It causes reinfection because the nose is already moistened with all this viral infection and the rest. So you insert the inhaler, you cover it again. In fact, it's already multiplying there. It's breathing more. So you want to use it again, you just put it in your nostrils again, inhale it, you're just reinfecting yourself. And so now what's in the case, some other people will collect it. Let me make use of this. You are sharing it with people. No, it's not the best.
So what makes it different from this one that they always do at home, where they put ventilated into hot water,
okay,
they cover their head with
that is very good. It's very different. When you do this, you're trying to inhale the menthol, you're trying to ensure that your airway is patent. All secretions will melt, will come out, you feel lighter, and at the end you discard the water immediately and wash your bowl. So this one is not going directly, you're not using an object into your nostrils, you are only inhaling the menthol so that you have a patent airway, and you discard the water immediately. And this water cannot be reused by someone else. It's just for you alone. You use, you discard, you wash the bowl, and get ready for another use if you want to.
Some people are so addicted to taking cold water, cold drinks. Would you say such should be prohibited, particularly during this season? Or maybe there are some kind of things they can also do, even after they want to take it? Because some people are so addicted to, if they are not taking anything cold, maybe
what I can say to this,
meal is not complete for them.
What I can say to this is, it differs with individual. Our immunity differs, but generally it's not good and it's not medically safe for you to just always take something cold. Some people will even be chewing block. No, it's not the best. It's not the best. It's good to take something hot. It's like cold cause constriction. When you take something hot, it's pave way. It ensures patency in your airway. So when you have cold and you are still taking something chilled, something iced, then you're causing more constriction. It will last longer. Yes.
And even in workspace, the use of air condition, I think it should also be minimized.
It depends on how your body can take it. The air condition is free, but how about fan? Once it's not dusty, and if it's dusty, it's not safe. But if it's not dusty and your body can still go on with it, fine. You can just get an additional clothing to wear, especially when you are more than 2-3 in the room. You also need the room to be well ventilated. But that is why it has regulation that you can reduce the effects. You can put it on just the environment atmosphere where you want it to circulate, so you can reduce the numbering. It's safe.
Well, I want to say a very big thank you to my guest on the show this morning, Mrs. Oluwatosin Olatokun, as we look at protecting yourself from cold and flu, particularly during this rainy season where illnesses like this are inevitable. Thank you for your time on the program this morning. I'm sure my viewers have learned one or two lessons, particularly how to boost your immune system, how to safeguard yourself from cold, and what are the home remedies. We talk about water therapy, intake of fruit, and all of that. These are something at our disposal. At least medication is expensive. I just had that discussion with somebody today that medication is expensive, very expensive. And they said that prevention is not only better, it's even cheaper.
Yes, and safer.
And safer than cure. So it's not be a bad idea if you can just cultivate the habit of taking enough water, buy food as you can afford. I think watermelon is still affordable to some extent,
yes,
unlike apple, pineapple, and all of that. These are the things we need to make sure that we use to boost our immune system. And of course, it's a phase. Season like this is a phase.
Yes, it comes and goes.
It comes and goes. So once again, thank you so much for your time on the program.
Much.
So we'll take a break now for sport updates with Adebola Adeleke. Do stay with us.